Which electrolyte imbalance is most likely to cause ventricular fibrillation? Correct option is D. Hyperkalemia. The Glasgow Coma scale does not assess which of the following. Correct option is D. Pupil size. In which stage of shock is cellular hypoxia reversible with prompt treatment? Correct option is B. Compensatory stage. Which hormone is primarily responsible for milk ejection let down reflex? Correct option is B. Oxytocin. Which isolation precaution is required for a patient with pulmonary tuberculosis? Correct option is C. Earborn. Which cranial nerve is assessed by checking for gag reflex? Correct option is B. The antidote for magnesium sulfate toxicity is. Correct option is B. Calcium gluconate. Which lung sound is most commonly associated with pulmonary edema? Correct option is B. Crackles. The main side effect of clozapine is. Correct option is A. Granulocytosis. Which vitamin deficiency lead to Wernicke's encephalopathy? Correct option is A. Vitamin B1. Intrauterine device mainly prevent pregnancy by. Correct option is C. Preventing implantation. Which cardiac enzyme is most specific for myocardial infarction? Correct option is C. Troponin 1. Which stage of labor is from full cervical dilation to delivery of baby? Correct option is B. Second. The Mantoux test used to diagnose. Correct option is B. Tuberculosis. Which type of shock is caused by severe allergic reaction? Correct option is C. Anaphylactic. A patient with lithium therapy should avoid excessive intake of. Correct option is A. Sodium. What is the normal range of intracranial pressure? Correct option is B. Which nursing diagnosis is priority for a patient with acute asthma attack? Correct option is C. Ineffective airway clearance. Which contraceptive method also protect against sexual transmitted infection? Correct option is C. Condom. The normal protein level in cerebrospinal fluid is. Correct option is B. Which insulin is used in diabetic ketoacidosis? Correct option is A. Regular insulin for. The drug methyl-dopa is most commonly used in. Correct option is B. Pregnancy-induced hypertension. Which is the earliest sign of hypovolemic shock? Correct option is B. Restlessness. Which lobe of the brain control personality and judgment? Correct option is B. Frontal. What is the most common cause of peptic ulcer disease? Correct option is B. H. pylori infection. Which vaccine is contraindicated in pregnancy? Correct option is C. Which electrolyte imbalance increase risk of digitalis toxicity? Correct option is A. Hypokalemia. What is the normal amniotic fluid index? Correct option is B. Which condition is characterized by moon face and buffalo hump? Correct option is B. Cushing syndrome. Which nursing action is priority after administering blood transfusion? Correct option is C. Check vital sign frequently. Which of the following is live attenuated vaccine? Correct option is B. Which type of seizure begins in one area of the brain? Correct option is C. Partial seizure. The hormone responsible for uterine contraction during labor is. Correct option is B. Oxytocin. Which is the most reliable sign of fetal well-being? Correct option is B. Fetal heart rate pattern. Which drug is first line of status epilepticus? Correct option is B. Diazepam. Which artery is most commonly used for cardiac catheterization? Correct option is B. Femoral artery. Which psychiatric emergency is most life-threatening? Correct option is C. Suicidal attempt. Which is the most common cause of postpartum hemorrhage? Correct option is B. Uterine atony. What is the primary source of energy for the brain? Correct option is C. Glucose. Which position is best for a patient with hypotension after spinal anesthesia? Correct option is A. Supine with legs elevated.